Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 116. A 17-year-old girl has made an appointment with the doctor. She plans to begin her sex life. No signs of gynecological pathology were detected. In the family history, the patient's grandmother had cervical cancer. The patient was consulted about the maintenance of her reproductive health. What recommendation will be the most helpful for prevention of invasive cervical cancer? A. Vitamins, calcium, omega-3. B. Vaccination against human papillomavirus, HPV. C. Immunomodulators. D. Antiviral and antibacterial drugs. E. Timely treatment of sexually transmitted diseases. Human papillomavirus, HPV, can cause the cervical cancer as well as vulva, vagina, penis, anus, or oropharyngeal cancer. The cancer often takes years, even decades, to develop after a person gets HPV. Genital warts and cancers result from different types of HPV. It is recommended that the HPV vaccine be given to girls and boys between ages 11 and 12, before they have sexual contact and are exposed to HPV. It prevents new HPV infections but does not treat existing HPV infections or diseases. It works best when given before any exposure to HPV. There are some variants of HPV vaccines. For example, bivalent HPV vaccine, 2-VHPV, quadrivalent HPV vaccine, 4-VHPV, and 9-valent HPV vaccine, 9-VHPV. Variants of HPV vaccine. Types to protect against 2-VHPV, 16 and 18, 4-VHPV, 6, 11, 16, and 18, 9-VHPV, 6, 11, 16, 18, 31, 33, 45, 52, and 58. The answer is B. Vaccination against human papillomavirus, HPV.